Welcome back to the channel. I read an interesting article in the New England Journal of Parenting. I mean medicine. Did I say parenting? Well, that's what they're trying to pass themselves off. This is about whether or not pediatricians should give advice to parents of children who are thinking about playing American football. That's right, American football has been in the news in the last few years. People are worried that if you play a career in the NFL, you may suffer from chronic brain damage or chronic traumatic encephalopathy or some type of damage from playing that. The understanding of that condition, what leads to that condition, the amount of concussions or subconcussive injuries that lead to that is still in its infancy. It's a very, very low level of evidence overall because it's a difficult thing to study. It often requires autopsy studies, et cetera, et cetera. But that's not what we're talking about. We're not talking about a career in the NFL. We're talking about what a pediatrician should tell the parent, in this case I think it was a father, of a 12-year-old boy who was thinking about playing American football. And of course, it was a pro-con debate. Somebody said he should advise him to play football, and somebody said they would advise against football. And of course, the right answer is, shut the fuck up. The right answer is to shut up about it, because the pediatrician does not actually have evidence for the relevant question, which is, should pediatricians, as a matter of practice, recommend football or not to people who seek their care? They don't have evidence for that. They haven't even begun to collect the evidence for that. They haven't thought about all the possible externalities, and they're injecting themselves in a parenting decision, in a decision of preference, what people like, the sports that people value. They're injecting themselves in something that's not really medicine. It's parenting, and that's a problem. So let me walk you through why I think the train has derailed. And worse, the New England Journal of Medicine is covering this. This is what they're spending their page space on. See, I'm an old-fashioned doctor. I want to know about what drugs I should give people with heart failure and whether or not the dose of Entresto that we're prescribing has anything to do with the Paradigm HF dose. That's something they should be talking about in the journal. I don't see them talking about that. I don't see very much critical appraisal of medical devices and drugs. Instead, I see an increasing push to go beyond medicine and inject yourself in social and political issues. And if you want to do that, then just don't call yourself a medical journal. Call yourself a journal of opinions and parenting, and in this case, opinions you pull directly out of your ass. So let's get to it. What's the heart of the question? Well, should pediatricians recommend for or against American football, or should they stay quiet? Now, my point of view is very simple. On all issues, pediatricians, if you don't have evidence, if you don't know that the routine administration of the advice leads to better outcomes, you need to shut the fuck up. That's a simple position. I've had that position for all sorts of issues. So when it comes to should my toddler wear a cloth mask, since there are no studies in that topic, you should probably shut the fuck up. Or you could add that it doesn't make a lick of sense and it defies common sense, but you certainly shouldn't recommend it. Unfortunately, the Pediatrics Association is run by zealots incapable of cognitive tasks like thinking, and they actually recommended it for 24-month-old babies. And that's pretty crazy. We'll come back to that. Let's just take this. Somebody comes into your office as a 12-year-old boy, and they're asking, well, they're not even asking. The question is really, do you volunteer your opinion on the topic? Let's say they're about to, you're doing a physical for American football. By the way, should they get physicals or not? That's something else we could actually have randomized data on. That's another question. But, they're coming into you. It's in the summer before the fall, and this pediatrician wants to inject themselves in this discussion. Well, the question is, if you tell 100 12-year-old boys who are thinking about football that they should or should not play football, what might happen? I suspect most of them are going to play football anyway. Okay, they've already decided in their mind. They don't give a damn what you think. A few of them may flip a vote, so you may go from, 85 playing football to 80 to 72. I don't know. You might change a few votes. Now, the boys that don't play football, what do they do instead? Do they sign up for soccer or tennis? That's possible. Or do they actually just sit on the couch and football was the thing they wanted to do? If they're not going to do that, they're just not going to play anything. Oh, do you know the answer to that question? Guess what? You don't know the answer to that question because you've never done that experiment. You don't know what your advice, your breath actually leads to among people. You don't even know the first step after you talk. You don't know if they're actually going to change their mind, what fraction change their mind, what they do instead. So already you're a bit incapable of thinking through the dilemma. Because if they play some other activity, they may still get the benefits of camaraderie and exercise. And if they sit on the couch, they may lose the exercise benefit. Last I looked around America, it seems to me that kids probably could benefit from more exercise. That's just my opinion. Now, you don't know that. You don't know that one effect. The second thing you don't know is whether or not tennis is a perfect substitute for football. Don't get me wrong, I play a lot of tennis. I love tennis, of course. I'm an Indian man. Of course, that's by nature what we had to do when we were growing up. We had to play tennis. Okay, but I actually love tennis. The question is tennis the same bond as in football? Is there something else about American football? And I have to say, I suspect there might be something to American football that goes beyond tennis. I much rather watch American football than watch tennis. Don't get me wrong, I love watching tennis. I love Wimbledon. Hashtag Djokovic should have been allowed to play in all those tournaments. But, I love watching American football more. It's actually something you cheer for harder, and we really, those of us from the Midwest, we relish it. It was a much more joyous event. What is it like as a player? That's something that, again, the pediatricians haven't fully captured, that dimension of socialization, of team building, of the camaraderie that comes. They don't know. Then the thing is, well, if the kid plays from 12 to 15, does he have an increased risk of brain issues down the road? Oh, does the pediatrician know the answer to that question? No, they don't know the answer to that question because the data for a short-term playing in your youth is piss poor. They have no data at all, really. They may know a few things about somebody who played for 25 years in the NFL. That's not the question they're facing. Of course, most of the kids they're counseling are never going to be NFL players. They're not even going to be college players. So enter the pediatrician and enter this New England Journal article where they're walking you through the pros and the cons. I read the article. The level of evidence of what they're citing is absolutely piss poor. The right study to do is actually a cluster randomized trial of pediatric practices where you give one advice or don't give advice and follow out health outcomes down the road. I suspect, if anything, if you inject yourself in these sorts of parenting questions, you are very unlikely to have any net health benefit and much more likely to have a loss of trust in the profession because we all know that American football has some association with politics and class, and you are just signaling, oh, just go play croquet instead, just play golf instead, just play tennis instead. And that may actually undermine some of the relationship. I suspect that those forces will far dominate any health benefit you'll get. I also suspect that very few people will actually change what they're doing based on you talking. In fact, that time you're spending talking is time you're not spending talking about other things like, wearing a condom when you have sex or not doing drugs or things like that. Then maybe they'd want to talk about or to figure out what the person actually came in with and what's actually bothering them or troubling them. That's time you're wasting about football. They haven't studied any of these things in a robust manner, okay? And yet they're injecting themselves in this debate. Now, let me do the journals first and then the pediatricians. The journals, what the fuck are you doing, journal editors? We want to read about medicine, the drugs we're giving, the devices we're using. We don't want to read speculatory pieces on American football. Next, should we have a pro-con debate of your doctor should tell you not to vote for Trump? I don't think we're far away from that. You are talking about nuclear war. Doctors should do more to combat nuclear war. You do realize that nobody wants a nuclear war. This is another piece that they covered recently that Mandrell and I talked about on the Sensible Medicine podcast. Nobody wants a nuclear war, but doctors aren't perfectly equipped to tell people what they ought to do to avoid nuclear war. We don't study foreign policy, government diplomacy for a living. Okay, that's not what we do. We should focus on what we do well, which is medicine, providing care for those who have problems and are ill, trying to improve health outcomes in those who feel well. Through the use of robust randomized controlled trials, we shouldn't just be giving our opinion on things we don't like. What's next? Should the doctor tell the patient to shop at Target, not Walmart? Where is it going to stop? Okay, you have your bounds. Your bounds are medicine. Now, you're trying to make football your bounds because you're saying concussion, but concussion is just one of the tiny, rare events that occur for of all the kids playing football, and it's not being thoughtfully balanced against the benefits like camaraderie and exercise and schedule and discipline. And you really don't know the counterfactual. You don't know if the kid who wants to play football is going to play a different sport or no sport at all. You've never even studied that. So why the fuck are you talking, honestly, if you ask me? Okay, so for the journals, you need to bring it back to biomedicine. We want to read biomedicine. You keep straying into social political issues. There's no one worse than Holden Thorpe at Science, who's just got a string of editorials praising Fauci, who he loves, and decrying DeSantis. That's not objectivity. To make political statements, to make statements about lifestyle and practices and things that people decide for their own family, that's not really the bounds of a medical journal. You're pushing into that territory, and I think you're rubbing a lot of people the wrong way. Now let's talk about the pediatricians. Now, during the COVID-19 pandemic, the American Academy of Pediatricians did two pretty stupid things that I've talked about on this channel. One is, they initially supported school reopening, But then when Donald J. Trump said he supported it in early July 2020, they said, actually, we changed our mind. Now, that's not a scientific or medical opinion. That's only the opinion of people who don't like Donald Trump, which, of course, the AAP doesn't because they're entrenched extreme liberals in that group. And so they changed and reversed their guidelines and sabotaged school reopening for the fall. They did that because they hate Donald Trump more than they love children. They actually are more political than they are rational, and they made a colossal error which will haunt them forever. The next error they made is that they actually advised, and this is against the advice of the WHO and UNICEF, European children's experts. They went ahead and recommended in this country that people, specifically 2-year-olds, wear a cloth mask in daycare except when they nap. That was reinforced by the CDC, and that actually became practice in many daycares around America. In fact, U.S. Head Start, the federally mandated program, had to have 3-year-olds masked because of these AAP zealots. They only have a zealot position in the absence of data because they get comfortable pulling things out of their ass. They love to tell people how to live their life even when they don't have data. And that's the crux of their problem. They need to shut up. They need not to inject themselves in places they don't have data. Just like cardiologists shouldn't write guidelines for disease states where they don't have randomized data, they should not involve themselves when they don't know the answer. The AAP should not involve themselves when they don't know the answer. I know the answer, that cloth masking a 2-year-old except when they nap is the dumbest fucking thing I've heard in my life, and only an idiot would think it would work. So I know that answer just because of common sense and eyes and ears. But if you actually subject it to a randomized control trial, I'm sure it would fail abysmally. Even the power calculation would tell you that it's going to fail because you're powering it for a sample size of 40 million people or something ridiculous because the effect size you're postulating is so abysmally small. That's if you're a proponent, which also means you're a little bit crazy because nobody rational would have done that. They're only doing that because Donald Trump didn't want to wear masks, so they want to mask extra hard, and that's the extent of their brain power on that issue. They got comfortable speaking about that because they're habitually comfortable about injecting themselves in issues that are not in the purview of biomedicine, but have to do with parenting and choices and things that aren't very quantifiable or certainly have not yet been quantified, as in the case of American football. The other example I would like to give is that historically, for babies at high risk of peanut allergy, the same AAP recommended an avoidance diet of avoiding the peanuts. That's a lot like avoiding the football, because they had some concern that early exposure to peanuts would trigger the peanut allergy. Of course, it turns out that early exposure to peanuts lowers the peanut allergy. Damn it! Oh, and that's what we discovered in a randomized control trial from Israel. So instead of talking, you could have been doing the randomized control trial, which, by the way, could have occurred 5 years sooner when you were issuing guidance. But you didn't do the study because your brain is not even open to the idea that you need studies. This is the crux of it. You don't even think. Before you comment about American football, you should just do a cluster randomized trial among 12 to 15-year-old boys seeking health care right around football season. Should you counsel for or against American football, you can randomize to that and measure health outcomes. You're not even thinking that way. You're just so cocksure that you know the answer about peanuts. Oh, whoops, you got that wrong. Masking a toddler. Whoops, you got that wrong. And this issue, it's a hubris in the field. It's a deep hubris. I got some people saying, well, what do you know about it? You're an oncologist. Well, actually, I'm an professor of epidemiology and an expert in evidence-based medicine, and I've had a long-standing philosophy that in all branches of medicine, when you don't know the answer, if you want to be honest, you should tell people, I don't know the answer. And so the only way to counsel somebody if they ask you, should my son play American football, is say, honestly, I don't know the answer. I do know the studies of chronic traumatic encephalopathy probably don't apply well to a 12 to 15-year-old boy playing for just a few years. I know that that's probably the case because those studies are weak anyway by any objective metric, and they're certainly not relevant to somebody who plays a short course of it. 2, I've not fully thought about all the intangible benefits that go into that. Of course, there's the exercise, there's the camaraderie, there's the fact that it is an American activity that deeply involves the American culture in a way that's beyond tennis. Let's be honest. They ain't people packing those tennis stands the way they pack those stadiums. It's a different thing. How do you weigh that as a doctor? It's not purely a medical decision. It's a values and preferences and culture decision. It varies by region and socioeconomic status, and it varies by maybe political persuasion too. And of course, the pediatrician should just stay out of all these issues. And if they want to involve themselves, then they really need robust randomized data that routine application of the recommendation improves outcomes for those kids, which of course, not only do they not have, they're not even interested in getting. And the New England Journal of Medicine, which by the way, is happy to reject our reanalysis of the child masking study because we extended it to all of Massachusetts and changed the date range a little bit, and we showed their claims evaporated. They don't want to print that in their journal. The counter-argument to some bullshit they've already published But instead, they want to talk about American football. It's very interesting what journals are doing. They want to become more and more Newsweek, more and more the opinion page of the New York Times, and less a scientific journal. No one's doing a better job of that than Holden over there at Science. You can just see his Twitter feed. He's a Biden supporter, and if you're not, you might as well not send your paper to Science. That's pretty much the impression I get from reading his tweets. So, should doctors advise young men to play or not play American football? No, just stay out of it. Just stay out. There are other issues, there are other things you could be doing in the doctor's appointment. One could be just ask someone, what's on your mind? What are the things that trouble you? What are you worried about? What are you concerned about? This is your dime. What do you want? What do you want me to talk about? What do you want to learn about? What are you worried about? What bothers you? Instead of that, they're getting involved in American football and who knows what else. Where's it going to stop? It's getting out of control. So I look forward to the next New England Journal piece on doctors combating climate change and stopping nuclear war and helping the Ukrainians and also stopping American football or whatever the hell else it is. But I'd much rather read something that has a lick to do with biomedicine, like drugs and devices. Maybe these drugs we're spending billions of dollars on don't have any good evidence. Maybe the fall booster campaign shouldn't be launched without any randomized control trials. Maybe the New England Journal of Medicine should talk about the fall booster campaign. Or maybe it should talk about how Paxlovid has no randomized data in vaccinated people, and the EPIC-SR study just posted the results on clinicaltrials.gov that it actually doesn't work in vaccinated people, and yet Ashish Jha is going out there saying it does, and also saying it may lower the risk of long COVID, a claim the FDA doesn't even allow them to make, and a claim that's not supported by any randomized data. Instead of talking about those issues that are medical issues about Paxlovid and boosters, the New England Journal of Medicine wants to tell you what you should be doing with your kid. And that is where they've lost me. They're crazy. They're all losing their mind in medicine. There's still this thing called the practice of medicine, and we can talk about that in the medical journals. And there's this thing called life, and you can talk about that in the opinion pages of the New York Times, or whatever other rag you want to read, or the NPR. Okay, I don't like those anymore because they got everything wrong in COVID. Wherever you want to talk about that. But let's at least have a place. Let's at least agree that sometimes we can talk about medicine. And there's nothing that shreds trust more than a doctor confusing their personal opinion, their personal political persuasion for biomedical evidence. And there's nothing worse than this American football piece. So if you like this video, you know what to do. Like, subscribe, comment, visit this channel, put some requests in, whatever you want me to talk about next. Hope to make some more videos soon. And I guess until next time.